Waking at 2 in the morning does not prove kidney trouble, but one bedtime food choice may influence sleep, blood pressure, and potassium exposure. That distinction matters because back pain has many causes, while chronic kidney disease often advances quietly without obvious symptoms during its earlier stages. Tonight, we will follow what your kidneys actually do during sleep, then test scientifically whether Tart Cherries truly deserve their growing kidney-friendly reputation. Stay to the end for a simple portion guide, crucial safety exceptions, and the bedtime mistake that can turn healthy fruit into trouble. Clinically, your kidneys sit beneath the ribs, filtering blood continuously, balancing fluid, electrolytes, acid levels, and hormones whether you are awake or sleeping. Inside millions of nephrons, blood reaches microscopic glomeruli that separate water and small molecules while safely retaining blood cells and, most important, proteins. Then kidney tubules reclaim what your body still needs, while wastes and extra water continue toward urine through a remarkably selective biological system. Healthy adult kidneys filter roughly 150 quarts of blood daily, not only during a special midnight detoxification window as myths suggest. Realistically, there is no reliable evidence that kidneys perform their most important cleansing, specifically between 11 at night and 3 in the morning. Importantly, what does change during healthy sleep is blood pressure, which commonly falls about 10 to 20% compared with daytime readings. Notably, clinicians call this pattern nocturnal dipping, and its absence is associated with higher cardiovascular risk and kidney disease in many studied populations. Crucially, repeated awakenings, sleep apnea, stress, and several medical conditions can disrupt dipping, keeping nighttime blood pressure higher than expected for some people. Scientifically, that association does not mean one restless night damages your kidneys, but persistent abnormal patterns deserve evaluation, especially alongside hypertension or diabetes. Clinically, if loud snoring, gasping, morning headaches, or severe daytime sleepiness accompany awakenings, ask about sleep apnea rather than blaming your mattress alone. Practically, kidney disease can remain silent because surviving nephrons compensate, allowing substantial damage to accumulate before fatigue, swelling, or urine changes become noticeable. Interestingly, updated United States estimates suggest about 14% of adults have chronic kidney disease, and roughly 87% remain unaware of it. Clinically speaking, symptoms are unreliable screening tools. Blood creatinine with estimated filtration rate and a urine albumin test provide far more useful information. Diabetes and high blood pressure remain major kidney threats, so controlling them matters much more than searching for a single miracle bedtime fruit. Importantly, still, food choices can support an overall kidney-conscious pattern when portions, laboratory results, medications, and individual potassium needs are considered together carefully. Notably, that brings us to the real puzzle: finding fruit with useful nutrients and manageable potassium, without promising detoxification, repair, or disease reversal. In practice, fruit supplies fiber, vitamins, and plant compounds, yet potassium content varies widely, creating different choices for healthy kidneys and potassium-restricted diets. Scientifically, healthy kidneys usually regulate potassium effectively, but advanced disease, certain medications, or acute illness can reduce that control and raise blood potassium. Excessively high blood potassium can disturb heart rhythm, which is why prescribed limits must come from laboratory results and your clinical care team. In practical terms, serving size changes everything. Even a lower potassium food can deliver a high total amount when portions quietly double or triple. Interestingly, the National Kidney Foundation distinguishes sweet cherries, which exceed 200 milligrams per 3.5 ounces, from lower potassium sour cherries below that threshold. That does not make sour cherries unlimited or automatically appropriate. A kidney dietitian can fit them into the potassium allowance your laboratory values support. The better question is not which fruit cleans kidneys, but which option offers enjoyable nutrition within the mineral, sugar, fluid, and calorie limits you need. Most importantly, form matters too. Whole, frozen, dried, juiced, concentrated, and sweetened versions can differ dramatically in portions, fiber, sugar, and potassium density. Notably, dried cherries pack many pieces into a small handful, making sugar, calories, and potassium surprisingly easy to underestimate during casual evening snacking. Crucially, juice removes most fiber and may concentrate sugar for fluid-restricted patients. Even an apparently healthy beverage must count toward the daily allowance. Scientifically, choose unsweetened products when possible, because added sugar offers no kidney advantage and may complicate glucose control, weight management, and dental health. Clinically, among these choices, Tart cherry stands out for an unusual combination of phytochemicals, modest potassium per reference serving, and intriguing sleep research. But intriguing is not definitive. Human trials are generally small, products vary, and findings from healthy volunteers cannot automatically be applied to kidney disease. Interestingly, tart cherries are sour, rubered fruits rich in anthocyanins, the pigments responsible for their color and much of their antioxidant research interest. Anthocyanins can influence oxidative and inflammatory pathways, but describing them as shields is a visual metaphor, not proof that cherries repair damaged nephrons. Realistically, tart cherries also contain phytomelatonin, a plant-derived form related to circadian signaling, although the amount varies with cultivar, processing, and serving size. Small controlled studies suggest tart cherry juice may modestly improve selected sleep measures, but it should not be presented as equivalent to medication. The sleep evidence remains promising rather than conclusive, because sample sizes are limited and different studies use different juices, concentrates, doses, and outcomes. If tart cherry improves sleep for an individual, better sleep may indirectly support healthier blood pressure patterns, yet direct kidney protection has not been established. That missing link is important. Sleep improvement does not automatically equal restored filtration, reversed chronic disease, or guaranteed protection from future kidney decline. Clinically, a recent trial reported lower inflammatory marker and urate levels after standardized tart cherry extract, but the participants were generally healthy adults. Practically, an extract cannot be translated directly into a bowl of fruit or juice because concentration, absorption, composition, and study conditions differ. Creatine protein reflects systemic inflammation, but lowering one biomarker does not prove that kidney tissue healed or that chronic kidney disease progression slowed. Fundamentally, tart cherry products may reduce serum urate in some studies, a finding relevant to gout research, though effects are inconsistent across preparations. Realistically, high uric acid can accompany gout and kidney problems, but cherries should never replace prescribed urate-lowering treatment or evaluation for kidney stones. For clinical context, for potassium, sour cherries qualify as lower potassium under the foundation threshold of 200 milligrams per 3.5 ounce reference serving. Clinically speaking, remember that classification depends on portion. 2 or 3 servings can quickly erase the practical advantage of choosing a lower potassium fruit. A measured half cup is easier to track than eating directly from a large bag, especially when frozen or dried products obscure quantity. For context, always remove cherry pits and never crush or eat them. The edible fruit is the intended food, not the seed inside. When available, whole or frozen unsweetened tart cherries provide fiber that juice largely lacks, helping fullness and slowing how quickly sugars are consumed. In practice, if choosing juice, verify serving size, added sugar, potassium information when listed, and whether your clinician has prescribed a fluid restriction. Interestingly, do not assume every red cherry product is equivalent sweet cherry juice. Mixed fruit drinks, concentrates, capsules, and gummies have different compositions. Supplements deserve extra caution because doses are concentrated, product quality varies, and potential medication interactions should be reviewed with a pharmacist or clinician. In practical terms, people taking potassium-raising medicines, including some blood pressure drugs, need individualized guidance rather than relying only on generic low-potassium food lists. Dialysis changes fluid and mineral management substantially, so timing and portions must follow the renal dietitian's plan instead of a universal bedtime ritual. Notably, diabetes also changes the decision. Sweetened juice can raise glucose quickly, while a measured whole fruit serving generally offers more fiber and satiety. Late acidic foods may aggravate reflux for some people, so move the serving earlier or skip it if tart cherries disturb your sleep. Scientifically, juice before bed also exposes teeth to sugar and acid. Rinse with water and maintain appropriate dental hygiene rather than sipping overnight. Used thoughtfully, tart cherries can be one optional food within a balanced pattern, not a nightly requirement and certainly not a kidney cleanse. For kidney health, their value is strongest when paired with blood pressure control, diabetes management, appropriate medication, activity, sleep care, and regular kidney screening. So the honest verdict is balanced possible sleep support, useful plant compounds, manageable potassium in measured servings, and important limits on kidney-specific claims. Fundamentally, blueberries offer another colorful option, supplying anthocyanins and fiber, while remaining relatively moderate in potassium when the portion stays around 1/2 cup. Realistically, population studies connect berry-rich patterns with cardiovascular benefits, but those associations do not prove that blueberries directly regenerate or detoxify the kidneys. A half cup is different from a large smoothie containing several cups, juice, yogurt, and added sweeteners, which changes potassium, sugar, and calories. Notably, fresh and frozen unsweetened blueberries are practical choices. Check packaged products for syrups or added sugar that can undermine the intended routine. One essential point remains: strawberries provide vitamin C, fiber, and diverse polyphenols, with a relatively low potassium amount in a modest half-cup portion. Scientifically, trials suggest strawberries can improve selected antioxidant measures in certain groups, but laboratory changes should not be advertised as proven kidney repair. Here is why. Combining small portions adds variety and flavor. Yet the totals still matter because potassium and carbohydrates accumulate across every ingredient. In practice, no single berry deserves magical status. Variety, portions, overall dietary quality, and consistency matter more than chasing one heavily marketed superfood. For kidney health, plain frozen berries can be affordable, convenient, and nutritionally useful, while pies, syrups, jams, and candies are not equivalent substitutes. For clinical context, choose among tart cherries, blueberries, and strawberries according to taste, glucose goals, potassium results, fluid limits, availability, and professional advice. Realistically, for adults without prescribed restrictions, start conservatively about 30 to 60 minutes before bed and observe whether the routine actually improves sleep. Importantly, option 1 is roughly half a cup of whole, pitted tart cherries, fresh or frozen, served unsweetened and measured rather than guessed. If using juice, choose a modest labeled serving of unsweetened Montmorency tart cherry juice, remembering it provides less fiber and more concentrated carbohydrate. Add a small handful of blueberries or several sliced strawberries, only if those totals fit your meal plan, glucose goals, and potassium allowance. For clinical context, before buying, compare serving size, added sugar, ingredients, and potassium. When available, marketing words like natural do not guarantee suitability. Clinically speaking, track sleep quality, awakenings, reflux, morning glucose when relevant, and how you feel for 2 weeks before deciding whether it helps. Do not let fruit replace proven sleep habits. Consistent timing, dim evening light, limited late caffeine, and evaluation of persistent insomnia remain essential. For context, for kidney health, reducing excess sodium and managing blood pressure usually carry stronger evidence than adding any specific berry before bedtime. If your potassium is elevated, your filtration rate is reduced, or fluids are restricted, pause the experiment and ask your care team first. For clinical context, lower back discomfort alone cannot identify kidney disease. Muscles, joints, nerves, urinary stones, infections, and other conditions can create similar sensations. Most importantly, seek prompt medical care for severe side pain, fever, vomiting, painful urination, visible blood, reduced urine, swelling, or sudden breathing difficulty. If you are older or have diabetes, hypertension, heart disease, or family history, discuss blood and urine screening rather than waiting for symptoms. Crucially, kidney diets are not identical. 2 people with the same stage may need different potassium, protein, sodium, phosphorus, fluid, and carbohydrate targets. For context, this video provides general education, not diagnosis or individualized treatment, and it cannot replace advice from your physician or renal dietitian. Please remember, never stop medication, delay testing, or substitute cherries for medical care. Use food as one supportive choice within an evidence-based plan. In practice, remember the 4-part takeaway: tart cherries may support sleep, portions control potassium, evidence is limited, and laboratory-guided advice always comes first. Interestingly, for clear health science without miracle claims, subscribe to VitaNHealth and turn on notifications for our next animated journey inside your body. Fundamentally, which would you actually choose tonight: tart cherries, blueberries, or strawberries? Share your answer and whether kidney labs have shaped your diet. Small habits matter most when they are accurate, sustainable, and personal. Protect your kidneys with knowledge, appropriate testing, and